I'm Ravi Hirekatur. I'm one of the physicians at Integrative Health, and to my left, I have Dr. Allie Hecht. She's a fellow in integrative medicine. And to my right, I have Dr. Supriya Paidemarry. She's a family medicine resident. The one pranayama or breathing exercise that we're going to be talking about is bee breath. Bee breath involves humming. Pranayamas come from yoga tradition. It's the fourth limb of yoga after yoga asanas, what's known as yoga in the West. It's an 8-limbed yoga system, and each leads to a higher level of consciousness. And this is the fourth limb that prepares one for the higher practices. So what does it do? Why do we do it? Bee breath is a calming pranayama practice. It also works with the parasympathetic system. It stimulates the vagus nerve. One of the oldest way of stimulating the vagus nerve is associated with parasympathetic system. It decreases heart rate, decreases anxiety, it decreases the fight or flight response. So it's the longest nerve in the body, goes from your brain all the way to your end of digestive system. A branch goes into the ears. So there are many ways to stimulate the vagus nerve. The oldest way to stimulate the vagus nerve is singing. Singing stimulates vagus nerve. That's why people feel better when they sing. And also chanting. A lot of traditions have chanting. And chanting, you're holding your breaths while you're breathing out, and then that stimulates the vagus nerve goes through the diaphragm, and then that stimulates the vagus nerve by holding the diaphragm up. So this is my go-to meditation. I use it in patients with anxiety, and also I use it in patients with irritable bowel syndrome who have bowel spasms. So in those patients, bringing the vagal tone, stimulating the vagus nerve, decrease bowel spasms, cramping, abdominal cramping, all those things. And then nowadays, most of the studies for IBS are done on instruments to stimulate vagus nerve. They can be very expensive, up to $5,000. So I tell my patients, why spend that much? Just sing in your shower, or sing while you're sitting, or do this bee breath practice. So that's as good as stimulating with an instrument. The only advantage of instruments is you can measure the response with the instruments. Here you don't have a way, but you can always measure it by how you feel. It also, the way we breathe, hum, it slows down the breathing rate. Our normal breathing rate is about 10 to 12, or 12 to 14 breaths a minute. And here you can go down to maybe 4 breaths a minute. We're also using our diaphragm, and that simulates the vagus nerve, as we talked about. We usually start with a cycle of 7, and then you can repeat after a 2-minute break, any number of cycles that you can do. Again, it's a calming pranayama, so one has to be cautious if they have low blood pressure, and also people who feel dizzy for other reasons like POTS or any of those things. I would say avoid that. Although in POTS, there are some studies that show that vagal stimulation using the equipment, the instruments, actually brings down the heart rate down. So this may be beneficial in POTS. May not be in hypotensive patients. So I'm going to do a cycle of maybe 3 or 4 breaths. 3 or 4 breaths may seem small, but again, given that this is long exhalation process, it may take some time. Take your glasses off if you wear any, and close your eyes with middle and ring fingers, and then push this part of the ear called tragus. It is a little extension here. Push that in, completely lock in the ear canal. And what it does, one is you're cutting out the visual stimulus. You're also cutting out the auditory stimulus that's coming from outside. So, and then when you close that, when you hum, it creates internal vibrations. And if you're able to focus your mind on those internal vibration, it has further calming effect. So I'm going to demonstrate a few breaths here. I push my tragus in and close my eyes. And normal breath in, exhale, and then next breath in deep. I think that's long enough. So as you have noticed, I'm breathing out longer. I'm also using my diaphragm, pushing my abdomen in. When exhaling, that also gives you an additional push to expel the breath out a little longer. So passive inhalation, in all passive inhalations in pranayama practices are deeper, but we're not putting extra effort into it. And then long exhalation as you're exhaling, just making the humming sound. Breathe out as long as you can, and then breathe in when you feel like you can't expel the air anymore. So again, in some circumstances, it can cause dizziness by decreasing the heart rate and blood pressure, but again, it rarely happens. Okay, so now again, as you're sitting in an erect posture with your feet on the ground, and bring ring and middle finger to your eyes to close it, and using your thumb, close down the tragus. Normal breath in, and deeper exhalation, and deeper inhalation, and hum. I'll let you finish 2 more rounds. Very good. Very good. How does it feel?
It's really relaxing.
Relaxing. As you do it, you might find that you're breathing out longer and longer, and that it decreases the number of breaths per minute.
Mm-hmm.
And there's nothing harm here, because we're doing deeper inhalation and exhalation using our abdominal muscles and diaphragm, so that doesn't generally tend to cause lightheadedness. But if you're in a hospital, if you're breathing at the rate of 4 breaths per minute, it raises all kinds of alarms. People bring in the crash cart and start resuscitating. If If you're on a monitor in a hospital, don't do this. Anyway, so this is something that I often use in my practice for people with anxiety, and especially with IBS. So I'm going to talk a little bit about studies. As in all pranayamas, it improves pulmonary function. And it also improves asthma control. There's one study that looked at, this is a fairly large study, 110 patients. They asked them to do a daily bee breath. It's also called Bhramari. Bhramari means bee, pranayama. So daily, I couldn't get the information about how long they did. Usually, typically done a cycle of 7, maybe 2 to 3 cycles every day. So they found that they had significant control over asthma scores, significant improvement over asthma scores. So it also improves heart rate variability like all other pranayamas. So also, we talked about decreased high blood pressure, decreased blood pressure. It also improves auditory and visual reaction time, improves the reaction time in adolescents, so that may have some implication in ADHD, although to date no studies have been done on ADHD. That's something I would like to see. And then sinus infection. This is really good for sinus infection. People with chronic sinus infection, when they did this practice for about 12 weeks, they found that they had significantly improved sinus congestion. There is a score for this. It's called SNOT 22. So they found that after those scores improved significantly. So doing it on a chronic basis, on a long-term basis for people with chronic sinus infections can be very helpful. It also decreased salivary cortisol levels. So that can tell us that it is decreasing the sympathetic response and stress response. So it also improved fatigue score and depression in patients with multiple sclerosis. So it has multiple uses. And so it's very valuable information here. So any questions?
Is that the typical rate that you use? Just kind of exhale as much as can.
Yeah. Again, each person has their own way of breathing, so it could vary from person to person. So when I began this, my respiratory rate was slightly higher than 4. It varies. If I'm doing it on a regular basis, I can bring it down to 2 a minute. But again, it depends. Depends upon how much one is practicing and what is the native breathing rate. That can vary from person to person. So there's no reason to set any goals here. You do what comes naturally to you.
If someone is uncomfortable or unable to hold up their arms like that, could you do it in like a laying position, or could you do it without your hands on the face?
You can do it either way. If you are having difficulty doing this, you can lay down and do it with the closing the ears, or in other situations, if, for example, you're sitting in an airport and trying to do this, then you can do hum silently without closing your eye. You can keep your eyes closed, but again, you may not be able to close the tragus. You can just say, breathing out as long as you can, doing silent hums. So that can be useful. Again, typically and traditionally, you close your eyes, you push the tragus. But again, in other circumstances, you can do it. Sometimes I wake up in the middle of the night and my mind is racing. I have a lot of things to do, so then I do it. I don't want to wake up anybody else. I just do hum silently. Or I can do alternate nostril breathing. That also helps me calm down.